Hello everyone, I'm Dr. Jibran, consultant neurosurgeon at Mythri Hospital, Mehdipatnam. Today I'm going to talk to you about a patient, a very interesting case that we recently came across. So this gentleman, a 45-year-old male, he came to us with a complaint of recent onset fever, after which his hands and legs suddenly stopped working. So he has been losing weight for quite a while now, and he's been feeling weak in his hands, felt some tremors in the past 6 months. As usual, we sort of examined the patient and we figured out that he was paralyzed from the neck down. Whenever a patient like this presents with us, the first investigation that we'd go to is an MRI. We got an MRI done and a contrast MRI done along with it because of some of the findings that were not making sense in this case. The contrast MRI, it revealed some tissue that was growing around the spinal cord in the cervical spine, which is your neck, the area back here. Now in the cervical spine, when you get something like this, I'll attach the images here so that you can have a look. India has been endemic for tuberculosis since time eternal. I can't remember a time back in history, I don't think anybody can, where there was no TB in India. So our assumption was this is a case of TB. Now it has been 1 month since he's completely paralyzed. So the hopes of his recovery, although minimal, we just wanted to delay progression in this case. This patient also has urinary incontinence. So for those of you that don't know that, urinary incontinence is an absolute lack of control of when a patient passes urine or when he goes to pass stool or has a bowel movement without knowing. You can understand that this is a very debilitating condition, but it is not very uncommon for us to encounter in our practice. Every third spine case in an unusual location is TB when it comes to our common practice, and this is the intention that we've moved forward with, planned for surgery. Patient was taken up, explained regarding the complications of surgery and everything that comes along with it. It sounds a little barbaric, but the plan was to do a laminectomy. So laminectomy is basically we remove the bone in the back half of your spine to create space for your spinal cord and whatever tissue is growing around it. The idea was to just take a sample of that tissue and also send it for testing so that we can start the patient on the right TB medication. As you all know, there are now a lot of strains of resistant TB, and this is the plan of action that we headed in with. Now here is where it makes a difference between a well-equipped hospital, a decent hospital. I'll not say a bad hospital because I very strongly believe there are no bad hospitals, but a well-equipped hospital makes the difference between your care and how much of a recovery you will make out of this. So we headed into the OT. It was a normal day, and as soon as we started, the patient was anesthetized. It's general anesthesia, high risk case. We had the whole team of anesthetists with us. Also, the patient has recently had dengue, so the platelets were a little low. He was in the recovery phase of dengue, but we could not delay surgery any further because in neuro, time is everything. We went in for the laminectomy surgery. The moment we removed the bone, we were met with something completely unexpected. So what we found was a very thick, very fleshy, very vascular lesion sitting there. Now, I'm not sure, but I'm confident that quite a few of you who are related to the medical field or who have had kids in their family have some skin related issues where the doctor must have told you something about a hemangioma. So a hemangioma is a tumor of the blood vessels. It can form anywhere in the body, but for it to occur in the spine, especially in a place where it can compress the spinal cord, is very rare. Now, the spinal cord is covered by a layer called the dura. All of the hemangiomas that we have read about so far have been within this layer inside the spinal cord. This was the first time that I was encountering a lesion like this in the extradural plane. Again, this is a little technical to understand, but you have to know the amount of thought process that goes into deciding the right treatment for a patient when you're operating, especially in such critical areas. So because we were that equipped, immediately a microscope was arranged for this patient and we got our micro instruments and then CUSA. There's a lot of very advanced medical equipment that went into this surgery. And intraoperatively, without thinking much of it, I saw that it was a tumor and I had to remove it. And eventually it took about 6 hours, but we had to dissect it away from the cord and remove the entire tumor. We've sent this tissue for testing. And right after it was done, these are the kind of cases that get surgeons very excited. There's something new that has come up. It is not routine practice. And because of the microscope, because of the micro instruments that were available, and the QSA and all of the advanced equipment that we had, along with radio frequency, we were able to get it all out, expecting that this patient might later need radiation therapy. Now, when I sent it initially for the first preliminary biopsy test, which is called a frozen section, it came out as cavernoma. Now, it might need another explanation about this. So, cavernomas are basically tumors that will never grow in life. In about 99.9% of the cases, they will never grow. So, radiation for this patient was out of the question. He did not need it. The fact that we got the entire tumor out, even though we were not prepared for the surgery, just because everything was made available within 5 minutes, in the same sitting we were able to get the entire tumor out, it meant that this patient would never need a second surgery too. Coming to whether he made a recovery or not, because in spine, all of these technical issues, all of these technical aspects of the surgery that I'm telling you about might be exciting to medical staff, might be exciting to doctors and other surgeons, but when it comes to the general public, it only matters whether the patient made a recovery, whether the patient was able to walk, whether the patient was able to use his hands again, whether he was paralyzed for life. The second post-operative day, this patient started walking again. The difference that a well-equipped hospital and a decent hospital has is that everything was made available to me in the operating room. Everything was ready. Within 5 minutes, a change of plan for surgery. Within 5 minutes, the entire plan, the OR that was booked, was changed, and I was handed the equipment to do it in the right way. Otherwise, if it had been another hospital, I would have just gone for the laminectomy, removed the bone, removed the pressure, come out, later planned for another surgery, put the patient through another round of general anesthesia, and all of that risk all over again. This patient has recently come back to my OP for a 3-month follow-up, and now that if you meet him, you will never realize that he was ever paralyzed in his life. He regained control of his urine within 3 days. When we discharged him, he was without a catheter. I'm telling you all of this is just to emphasize the fact that you need to do better for your health. Go to a place that is equipped to deal with complications that arise like this. Complications can happen in any surgery. Sometimes you are met with very unexpected monsters. Just to give you the context, this was the 72nd case in the entire world, in all of history, of an extradural cavernoma in the spinal cord. 72. We're getting it published. We're obviously sending it for some academic research too. But to be able to handle a case that has happened 72 times in the existence of mankind in all of the world, that is the kind of place you want for your care. That is the kind of hospital you need to be at. And we are here, available all of the time for neurosurgery. The Department of Neurosurgery at Mythri Hospital, absolutely equipped to the teeth, and we promise to take very good care of your patients. Thank you.